All right, welcome everybody. Thank you all for attending this month's Spotlight series. Today we have Erin Babineau and Jen Jocelyn presenting on pelvic health. Floor is yours.
All right, welcome everybody. Today, Erin and I will be presenting on pelvic health is just more than Kegels, and we'll go ahead and get started. So my name is Jen. I'm a physical therapist with extra training in pelvic health. Just some fun facts about me. I've raced 10 marathons. I enjoy cooking, reading, and spending time with friends and family. And this is my 3-year-old golden doodle named Benji.
And I'm Erin. I also have further training in pelvic health, and I also did a postdoctoral residency program. So that's after your doctorate program, doing a year of mentored training and extra classes, and then a wonderful boards exam after that. I played college hockey, which led me to the world of bandy the last few years, and I luckily got to go to Sweden and play on the USA team this past spring, which was super fun. And those are my two little cute kitties, Pecorino and Percini. We have fun clicker training and cuddling up.
Awesome. So we have a wonderful pelvic health PT team here at NICE. We are doctors of physical therapy with extra training in pelvic health. And so what that means is we've had 4 years of undergrad, 3 years of physical therapy school, and received our doctorate of physical therapy. And that extra training in pelvic health means that we've had lots of continuing education, mentorship, and also just years of experience. So our team includes Erin and I, but also Priya Patel and Ryan McNeil.
So, Jen, what are some common misconceptions you see daily in clinic around pelvic health?
Yeah, it's a really good question, and I think it's really helpful to talk about this. So, something we often hear about pelvic health is we kind of think about a woman who is pregnant or postpartum. And I think something we really want to highlight today is that pelvic health can include all genders and also all ages. And so, while we don't provide pediatric pelvic health here at NICE, it is a resource for pediatric patients in person. So, again, just really understanding that anyone can have a pelvic health concern. I think the second thing that can be important to discuss is oftentimes patients are either told or maybe they read that they should do Kegels to address their pelvic health symptoms. And what we find, and I think what we're going to highlight again in this presentation today, is that a holistic and team approach is really helpful for these patients. And sometimes doing Kegels can be an inappropriate treatment approach and can be really hard for people to perform. So we'll highlight today how we typically approach pelvic health concerns, and again, how we can all work as a team to support these people. What about you, Erin? What do you like? What do you typically hear?
Yeah, I'd echo all those things for sure. And I also find that unfortunately, some of these folks are kind of getting lost in the medical system. So they're not always properly screened with their public health history. And so we're having a lot of aha moments with our screening, which is really powerful for people because they're finally then getting the care and kind of plan in place with the team. And it often is a team effort, like you said. So we have a lot of those conversations and finally get people on the proper treatment plan. So we'll talk a lot about that too, on just getting them screened and how we do that. So
Okay, and let's talk about where pelvic health is today. So something that we know is that it can take 17 years for research to convert into clinical practice. And only 1% of the $500 billion spent on healthcare research focuses on women's health. So while our research is catching up, there's still a really long way to go. And something that we notice is that sometimes these gaps are filled in with societal pressures or societal norms that really just place unrealistic expectations on our anatomy, female and male anatomy. And therefore, we really want to make sure we're normalizing these conversations and using this integrated team model, holistic model to care to help to support these people so that they can really get that care that they deserve.
So these are common symptoms. I think most folks are familiar with kind of those bladder bowel symptoms listed there. we'd like to highlight, of course, we're using all team members to properly screen. So we do see abdominal, pelvic, penile, and testicular pain in our office. So if every kind of other systemic thing has been cleared and we're kind of at a loss point, there can be a pelvic floor component there. So we do see those folks often. That it also includes the hip and low back and pelvic girdle, of course, too. So we do see some of those folks who've had 10 rounds of back pain treatment and we finally are screening and oh wow, there's a huge pelvic component as well. And then we also see people during pregnancy, so not just postpartum. There's big body changes happening during pregnancy that we support people to stay active during that time and get more comfortable. And although maybe not in our office, we are seeing people for painful intercourse and sexual dysfunction and post-operatively, whether that's gender affirming care, post-op hysterectomy, prostate procedures, or hernia. So in those cases, an integrated care approach is very important, where we might refer to types of therapies, sex therapy, in-person pelvic PT, and then obviously working with a medical provider. And we're always helping navigate that, which we'll talk about later on. And I did miss, we're also helping people with pre and postmenopausal symptoms. So helping people through those transitions as well.
Okay, so now that we've talked about common pelvic health symptoms, we can start talking about some prevalence and just normalize some stats. So one thing we've seen in the research is that only 1 out of 3 women accurately perceive their pelvic floor muscle activation. And so what that means is only 1 in 3 women have the ability to make that mind-muscle connection of, okay, I know where my pelvic floor muscles are, and I know how to coordinate that contraction and relaxation of my muscles. So for most people, this is really difficult to do. And so that kind of just do Kegels messaging is not always helpful because it's just a really difficult skill. And again, it's not the end all be all. There's so many different ways that we can approach this that might be more beneficial.
And we also wanted to highlight the impacts on exercise. So a few studies show even women who have not given birth in middle age, up to 47% of them can have some sort of urinary incontinence. And 50% of those folks will have a negative impact on their exercise regimen. So we're helping a lot with people trying to stay active and have better experiences during those phases of life. We also see a high prevalence in college athletes. In some sports, up to 50% of some college athletes are having incontinence. And then we also wanted to highlight that 60% of females are inactive during pregnancy. So again, we are seeing people postpartum, but it's super important to support those folks even during those body changes that are happening with pregnancy.
Lastly, 80 to 90% of postpartum women have painful intercourse for the first time, and only 15% talk to their doctor about it. Also, 49% of men by the age of 70 experience erectile dysfunction. And so what I think is important to highlight here is that screening for sexual function can be so helpful for people because it really can be an indicator of their overall physical and mental health. Of course, these conversations can be a bit vulnerable, uncomfortable, so it's really important to ask for their consent and just kind of practice with that trauma-informed care, helping them to feel as supported and comfortable as possible. These are conditions that we don't typically treat virtually, but that being said, we're always open to collaborating and consulting with these patients so that we can get them into the right office and kind of help to develop that care team. So again, they can receive that support.
And I think we really wanted to go through these stats just to expose everyone that pelvic health is important for all types of people, all age groups, all genders, and there's a lot of help out there. So just because this stuff is common does not mean that people just have to deal with it. And I think we play a really unique role here at NICE with our integrative care model, that at every step of care, we can start normalizing these conversations, which really helps build societal awareness and helps build that team for someone so that these people get the support that they deserve.
So now we can take a minute to talk about where these muscles are located and how we typically approach pelvic floor treatment. So we'll kind of start with that bottom right corner picture. We've got male and female pelvic floor anatomy. And so everything that you see there that is red indicates a pelvic floor muscle. And so, we often think of these muscles and we think of bladder function, bowel function, and sexual function. They're able to contract and relax, lengthen, but they don't work in isolation. And so it's really important to think about this kind of big picture. And we know that these muscles kind of make up this intra-abdominal pressure management system. That's comprised of our diaphragm, our core and low back muscles, our pelvic floor muscles, and kind of everything in between. And so when we treat these patients, we really want to think whole person. We want to think about their functional goals and their lifestyle habits. So to give you an example, treatment can look like cueing a person through their squat form so that they can use that pressure management system to avoid leaking when lifting their child. We can discuss pelvic floor relaxation to help a person completely empty their bladder, or it might be a discussion around what they're drinking on a daily basis to help to avoid perhaps some bladder irritants that might be impacting their symptoms. Lastly, the brain is the organ that controls everything. And so it's really important for us to consider the nervous system when we develop our treatment plan, because that plays such a key role.
Yeah, and in the PT space, we're definitely, and a lot of therapy spaces, focused on that biopsychosocial model and very important, especially in the pelvic health space. So like Jen said, we are focusing on the biology of our brain, nervous system, those muscles, and those coordination, but we're also really focused on some of those societal and psychological impacts. They are equally as important. So we do rely on our wonderful mental health team to support with that. I often say the elephant in our room is we are focused on new lifestyle habits, so those specific goals that people need support with. And of course, using trauma-informed care. A lot of folks haven't talked about their sexual health or pelvic floors before, so it's a really new experience and space. And we recognize and always prep people that if it's not with our mental health team, we'll get them to a longer term support, which is usually trauma therapy or sex therapy, which we'll talk about shortly. So we're setting up people for success with expectations with that. And I think the goal here is just, complicated problems require multiple modes of support. So it is not a one all be all with pelvic health PT. We are relying on all team members, and we're so thankful for our integrated care model at NICE that we can do that.
So we can discuss now what virtual versus in-person physical therapy looks like. So here at NICE, we perform virtual physical therapy. Typically, it's a shorter term program, around 6 to 8 visits. And again, that focus is really on lifestyle changes like diet, fluid intake, patient education. So for example, teaching them strategies to help manage their symptoms in the moment, and stress management. So that can tie in with mental health, our nervous system, sleep, and then developing a really solid exercise program that really just thinks about that whole person in mind and allows that person to stay active. With in-person care, there's the option for manual therapy or hands-on treatment, and there is the option for a pelvic or rectal exam. I think it's helpful to take a pause here and just kind of discuss what that might look like for the patient. I think the first thing that I want to acknowledge is that this pelvic or rectal exam can be sensitive, and it may be something that a patient isn't interested in participating in. And so what I want to say about this is that it's never mandatory, and the patient will always be able to give informed consent when it comes to participating in this examination. What it looks like is a pelvic health PT is wearing gloves, using lubricant, and inserting one finger vaginally or rectally to kind of help to understand what these muscles feel like, areas of sensitivity. But I think most importantly, it's helpful to know that this exam can help the patient really understand where these muscles are located and how to be able to coordinate them and also understand how they're part of that larger system. So it can be a valuable education moment for the patient. But again, we just want to acknowledge that this exam doesn't even have to happen if the patient is not interested. There's so many ways to approach this, but sometimes it's helpful to know what it might look like. And then lastly, in-person care provides longer term support. So some examples of conditions that are most appropriate for virtual or in-person care is dyspareunia or painful intercourse, erectile dysfunction, extensive pregnancy or postpartum care, post-surgical and gender-affirming care. And again, regardless if this is virtual or in person, we're always co-managing as a team. That can be mental health, in-person pelvic floor PT, OB, primary care, or medical doctor specializing in pain. So I think we would really like to highlight here that we're always open to collaborating with all of you so that we can work as a team to help and support these patients. Another thing I'd really like to acknowledge is that as physical therapists, we can advocate for annual wellness screenings. So that way, again, we're thinking about the person, whole person, and these symptoms aren't being missed.
Great. So let's go through some case studies just to give some examples. This was a 31-year-old male who made a direct access scheduling with PT for some increases in low back pain he was having. And after our ortho PT screened him, they did a very thorough subjective, which was wonderful. Really emphasizes that because they realized that he was also having increased bowel urgency and IBS symptoms with that increased back pain as well. So he got referred to our public health team, and after chatting with him, we got on a care plan that focused on holistic goals around daily movement, bowel irritants, bowel mechanics, so how to bear down properly, and different ergonomics with his computer setup and lifting at work. And then we also worked on that pelvic floor relaxation and range of motion kind of coordination with him. And we also developed obviously an exercise plan and daily movement plan. So we did end up working on kind of pelvic movement and core and hip strengthening and different things that were specific to what his needs were. And we did end up referring to primary care. There's some wonderful folks with kind of nutritional backgrounds that we rely on a lot. Thank you all. And I had him meet with one of our team members to work on supplementation to help with some of his loose stool that he was battling at the time. And I did also refer to mental health team at the time because he was having a ton of social anxiety around his bowel urgency when he was around friends and family. So he worked with all of our team members. This is a great job by everyone on our integrative care team to work on all of those symptoms. And the outcome was after 5 PT visits with us and a handful with mental health and a few with primary care, he was no longer having bowel accidents. He had minimal back pain and much less anxiety around IBS and his bowel urgency. So way to go, team. Yeah.
Awesome. So another awesome example of teamwork here. We had a 23-year-old female with increasing low back pain. She was experiencing more stress and therefore less physically active because she had 2 young kids at home, a 2-year-old and a 1-year-old. She was experiencing urgency and frequency of urination that was increasing. And so she was working on some Kegels that she found online, but she was noticing that her symptoms were getting worse. So she scheduled with us, the Pelvic Health PT team, via direct access. And after a full subjective history, what we worked on was focusing on pelvic floor lengthening and relaxation techniques and dialing back on the Kegels. We avoided just in case urination. And so that's the idea of, okay, I'm going to go to Target. And so I'm going to pee just in case so I don't have to go when I'm there. So kind of trying to avoid or work on troubleshooting how they might allow themselves to hold their bladder longer and keep their nervous system calm, and also avoiding power peeing. So that idea of kind of pushing and straining to urinate instead of kind of focusing on relaxing and lengthening those pelvic floor muscles. We increased daily physical activity with a full body strength training routine twice a week, set some walking goals up to 150 minutes per week with their family, decreased caffeine intake, and encouraged the patient to sip on fluids, and then referred to the mental health team so that she could focus on some stress management and self-care. So again, with this teamwork, after 6 visits, she was no longer having urgency or frequency. And if she was having symptoms at any time, she had the tools and strategies for managing these symptoms in the moment. her back pain was improving, and then she was now able to prioritize self-care and stress management goals. So again, good job, team.
So key takeaways, pelvic symptoms often require that integrated care approach. So, all parts of that care, biopsychosocial model is so important. So we're so lucky here at NICE to have that. That subjective history is important. So, like I said earlier, we have a lot of aha moments in our office of finally getting someone on a care plan that's makes sense and they actually have symptom reduction. And we really are changing people's lives here at NICE. So keep it up. The other thing is life is dynamic. Exercise and movement has to be part of a person's plan. It has to mimic their functional goals. So laying flat on a table doing Kegels usually isn't, again, often helpful, and something we don't prescribe too often. And during that, because of that, we're kind of often combating cultural and societal pressures because the research is so new and limited. So we're doing a lot of education in these spaces. And of course, in our PT world, we're always screening for red flags and differentials. So again, we're so thankful here at NICE to have everyone on our team that we can refer out to when needed. And big key here too is that knowledge is power. So we're working on patient empowerment and we are making huge differences in people's lives. So keep up the good work. And the more we can have these conversations at each level of care, it really is helping shift those societal norms. So keep it up.
Hey, does anyone have any questions?
I can give you a question if no one's, am I jumping in too soon?
No, I don't think so.
Okay, cool. Jen, so what I know in our day-to-day life, we have family and friends approaching us constantly like, what's that one thing that I could do? I'm dealing with X, Y, or Z with pelvic health stuff. Which again, we love that people are talking about it more and encourage those questions. But if you had to give one thing in those moments, what would you give?
Yeah, I think this is a really good question. And I think that just having the conversation is really powerful. This might be the first time this person is ever discussing these symptoms with someone. So the fact that we're normalizing this and just providing support is huge. And that alone is helpful. But that being said, I think thinking about that integrated care team and sharing with the person that, hey, there's help for you. It might take a team approach. That's normal, but there are so many people out there who are willing to support you. So from a NICE PT perspective, that could look like us collaborating and troubleshooting together on this patient, consulting with the patient to point them in the right direction. And even if it isn't something that we're able to treat virtually here at NICE, we're able to sort of start to help develop that care team, so they can get their support. So I think in summary, it's always wonderful to talk about it, empower, show empathy for these patients because this is hard stuff to talk about, but also letting them know that there's help out there. And there really isn't one size fits all. Everybody's unique and different. And so we want to really consider that with these cases.
And Kelsey, I saw that question. We do have in our slides some of our favorite go-to references.
Yeah.
So we'll share that with y'all and you'll see it further in our talk here. So yeah, of course.
I'll click over there.
Yeah.
These are some really great resources here, and you'll have access to these slides so you can take a look. But especially that book here, I think can be really beneficial.
And never hesitate to reach out if there's a case that they just want general information just to get more comfortable in this space. We're happy, to give broad resources like this that aren't specific to the person, of course, until we talk to them, but just starts normalizing some of these conversations. Mhm. Is there other questions?
Every time I find a new good lounge set, my mom immediately wants it or buys it. The one that I had on in purple, you have in pink, and then you also have that half zip one that I have in pink.
I thought it was a question. I think someone has their recording on.
Oh, okay.
Yeah.
I did want to mention something that you guys brought up of how the complexities of this. And so just so that primary care providers know, when we evaluate the patient and we get that thorough subjective, we are just starting to peel the onion. We hear more as we get to know them, more of their truths start to come out as they trust us. Jen, you mentioned it's very vulnerable, very sensitive. And so we kind of have to pace ourselves as we go through these sessions. We have to, of course, build that rapport and allow the patient to feel comfortable. So when I see things like books on sexual health, that is, of course, a very heavy topic, oftentimes very relational. So going at it with just, one partner of not having the other partner. The point of that is, the point being with me saying this is that oftentimes we'll get them started on a treatment plan, but if so much is uncovered throughout the course of their plan of care, where we feel like it's time to bring in maybe an outside resource like a sex therapist. I know you guys mentioned that. So we will often get started. We might even bridge a program where we kind of talk about education, we address some of their symptoms, but if we find that they need a higher level of care, we will always refer out. So, and if you're ever unsure, we are more than happy to consult with the patient just to kind of steer their care along the way. Because oftentimes, like you said, Jen and Aaron, both of you guys highlighted this so much that we just need to start the conversation. People just don't know where to start. So I feel so grateful that we have this team here where, I mean, we're just kind of spreading knowledge. It's so impactful.
Yeah, I often say we're kind of like quarterbacking to help them create that. And I think that's a really cool role in the virtual space, especially with more short-term care models, but really helping them have that quarterback that's helping create that team for them. So we are always welcome to consults and really want to support these folks that are very underserved.
Yeah. All right. Any other questions?
One thing I would just want to highlight, I'm kind of new to this pelvic floor world, but something that I've come to appreciate is that, I graduated PT school in 2011, and I find that the knowledge that women have has been increasing exponentially, where at the beginning of my career it was like, hey, have you ever talked to someone about this? Or what did your physician tell you? It was like, oh, just do Kegels, or like, oh, no one ever said anything, So now it's getting to the point where everyone's at least aware about this, which is really helpful to see. And then just that part about like, don't just do Kegels. I mean, you guys highlighted that 1/3 of women can do it correctly, but the other part of it is that I've come to realize is that there are people where that is the exact wrong thing for them to be doing, and that's why it can be so difficult for us to give general resources on how to approach that. So I just wanted to make sure that was explicitly stated.
Mhm.
Thanks, Ryan. And I think often we are seeing some folks, unfortunately, who've had years of pelvic symptoms and finally make it into our office. And because it's so new, they were never offered those resources. So someone going through menopause and also maybe had a history of endometriosis has never heard of pelvic floor PT, and they're 60 years old. And so we still play a really strong role in those cases to help educate and get them tools on where to head, which is exciting and also hard for a lot of folks too, right?
Yeah, and I think it's important to remember too that it's never too late to get started. If there is a patient who's never heard of this before and they're just learning, and unfortunately they've had these symptoms for a long time, it's still never too late. No one is hopeless here. There's always support.
For sure.
Thank you, Jen and Aaron. This was so wonderful. And providers, if you all have any questions, you know where to reach us, you know where to find us. Thank you all for attending. I'll be uploading this presentation very shortly.
Thanks so much, everybody.
All right.
Thanks for all that you do.
Bye.
Thank you.